venous disease is a huge group of diseases, which includes congenital disease as well. So here, when we're talking about chronic venous insufficiency, we're not really including things like malformations, arteriovascular malformations, and hereditary disease, in the sense that you have congenital disease. Here, we're actually talking about disease which is acquired later on in life. Okay, and there are many predisposing factors to that. So again, that big group is called chronic venous insufficiency, which is literally based on the insufficiency or lack of efficiency of the valves along the veins. You know, the bigger veins and even the smaller veins have valves. Now, those valves are like any other valve. They are designed to allow flow in one direction only. And the valves in veins allow blood to come up, go up towards the heart. So come proximally from the feet all the way up to the legs and to the knees and thigh and so on. So those valves are designed to stop the reflux and reverse flow. So when you stand up, if we do not have the valves, then what's going to happen? The blood's going to gravitate towards the ground, and gravity is going to pull it down there, and it's going to pull. So when it pulls, it stagnates, it cannot go up again. So what actually guards against that is the presence of sets of valves every couple of inches or so along those veins. And they are extremely important for the integrity of the vein, and they maintain the blood flow in the proper direction, which is upwards. Now, if those were to fail for any reason, and there are many, many reasons for their failure, and of course there are hereditary conditions, because these things do run in families, that they have weaker valves or absent valves in certain situations, which means that the remaining valves will have to take the brunt of the load of blood, and therefore they're more likely to become incompetent. So once they become incompetent, it's like a self-fulfilling prophecy, where the next set of valves is going to fail, and the next one, and the next one, until all of them fail. So when this happens, a very nice slim vein is going to start getting baggy, just like those long balloons that we get at Christmas time. You know, they're nice and slim, and if you get them, they're very hard to blow into initially, but then once you blow them out and extend them with, inflate them with air, then when you deflate them, they're not going to be the same. They're going to get a little baggy, especially when they had been inflated for a couple of days. So when you come way after Christmas, after the holidays are over, and try and take down those balloons, you find that they are baggy and they have little sort of pouchings here and there. Varicose veins are very similar to that. So varicose veins are really veins that have been distended beyond their capacity, and that distension has not gone up and down as happens sometimes normally, but this distension has continued day after day, year after year, for a long, long time, and therefore those veins become very baggy. Now they start pushing when they start sort of getting enlarged and distended. They start pushing into the areas of least resistance. And it so happens that the areas of least resistance are fat and skin. So they don't go inwards, they tend to bulge outwards. And of course, many people who have varicose veins, they come to us, and the first thing they notice, apart from, of course, the feeling of heaviness in the legs and the changes in the skin, they do notice the bulgy veins. And there are certain areas where those veins are more likely to bulge, like in the lower thigh and around the knees and in front of the thigh in certain situations, and of course below the knee on the medial side, on the inner side of the leg. Those are the most likely places. Of course, they can bulge in other places. But those are sort of basically varicose veins, which are veins which have distended for a very long time because of the back pressure and the amount of blood that actually stagnates in them and distends them beyond their capability. And by distending them, the valves that normally would touch, now they are splayed apart, and therefore the valve distends, the vein distends even more. And that causes a lot of inflammation in the area, and that would explain why people sort of get tender around those veins. And the skin changes are also extremely important, also because of the inflammation that sets in.